Hey guys, Mrs. Milan again. We are, believe it or not, finishing up chapter 5 already. There's 4 objectives for today. You need to, first of all, identify things that need to be recorded in a patient's chart. Number 2 is identify rules for charting in a patient's medical record. Number 3, describe items that are in the Cardex. And number 4, identify the steps in the nursing process and be able to describe what happens in each step. So I encourage you to follow along in the PowerPoint that there's a link to on the website. So let's talk about a patient's medical record, or the patient's chart, if you will. A lot has changed with healthcare recently than what it used to be. It used to be we had all of these papers in a blue or green or whatever color kind of flip chart. And there are some areas that still use those. Not very much now that the majority of the information is done with computer documentation, but there's still a chart in some way. In other words, there's these different forms in that online or computer documentation. So we still use them. It's just that they're not kept in the same format as they used to be. There still is typically some kind of hard chart that is at the nurse's station with each patient, but it's not as thick or as cumbersome as it used to be. But some of the areas of the chart, whether it is being done on paper or being done on computer, that you might need to familiarize yourself with eventually if you start working in healthcare, includes the admission sheet. This is kind of the area that has all of the patient's demographics, their name, their address, maybe their social security number, what kind of insurance they have, who their doctor is, kind of all that basic information. So that would be the admission sheet. The medical history lists all of the person's pertinent medical history. Have they had surgery before? Do they have a family history of chronic illnesses, things like that, that you can go back and look over what kind of health care they've received or what kind of problems they've had in the past. Nursing history would be things that the nurses have been doing for the person while they're here, like vital signs, maybe, or treatments, dressing changes, things like that. There will be a physician's order sheet. These are where the physician writes down all of the things that they want to happen. We, as nurses or nursing assistants, can't do anything without the doctor's permission, so to speak. So the doctor has to tell us everything they want. So how often they want vital signs, what kind of medications do they want, what kind of food are they allowed to eat, all of those kinds of things. And the doctor has to list all of those out for us. Medication sheet, sometimes called a MAR or medication administration record, is where we document when we give the patient medication. So any kind of drugs, any kind of IV, all of that kind of stuff has to be documented in the person's chart that they've received it. So that's where we do that at. Physician's progress notes is where the physician keeps track of how well the patient's doing and how they're progressing throughout their hospital stay. Narrative nurses' notes are where nurses handwrite out notes, like maybe that we got them up to the bathroom, or how much how far they walked, whatever. A graphic sheet is a term that we use where we graph the person's vital sign. We'll actually chart out like their temperature over a period of time, maybe their blood pressure, their pulse. And then there's miscellaneous documents. You can find ultrasound reports, x-ray reports, surgery reports. There's all kinds of stuff in a person's chart. Now, don't confuse their medical record with something called a Cardex. In a Cardex, well, first of all, go back to the medical record for a minute. The medical record is a legal document, and anything that is charted or putting in there is legal. So it could be used in court, kind of thing. It's like permanent. A Cardex, on the other hand, is kind of like a simplified version of the chart that we kind of transfer all the information over, and just as nurses or nursing staff, like nursing assistants, use that information to take care of the person. It tells us how often they need vitals, how often they need walked, how often they need a bath, all that kind of information kind of condensed into one little area so we can look at it quickly. This, however, is not a legal document. This is just to be used for like the staff. Now, the nursing process, sometimes called the nursing care plan, is a communication tool that the nursing staff uses to kind of take care of the patient. So when a patient is first admitted, we use this nursing process to figure out what's wrong with the person, make a plan, and so forth. And there are 5 steps. If you remember ADPIE, that will help you, because the abbreviation, the first letters are ADPIE. But A is assessment. So this is where we gather our information and figure out what's wrong. We take their vital signs. We listen to their breath sounds. We listen to their abdomen. We figure out what they're complaining about or why they're here. And we kind of gather all this information. So that's assessment. With diagnosis, we figure out what's wrong, okay? So this is what's wrong. That's what a diagnosis is. Now, the doctor obviously has a diagnosis, but this is as far as nursing, what we can do, okay? So this is diagnosis. Planning is where we figure out what we can do, all right? Can we help them with bathing? Can we help them with medications? Where can we help them? Implementation is where we put in our plan into effect. So we figure out what we do, then we're going to do it. And then last but not least, we see if it worked. Okay, that's all evaluation is. So we gather information, we figure out what's wrong, we make a plan, we do our plan, and we figure out if it works. As simplified as that sounds, that's what the nursing process is, and we just do it over and over and over again until we can get the patient all better. So you do need to kind of know what each step is and what happens. So for instance, assessments, we gather information. Diagnosis, we figure out what's wrong. Planning is we come up with a plan. Implementation, we do our plan. And evaluation, we see if it worked. So that, simply put, is what the nursing process is. And that is it for chapter 5. We're done with chapter 5. So if you have any questions at all on communication, please let me know. Otherwise, tomorrow we will review for your test on chapter 5, and we'll just keep going along here. See you guys.